Welcome to One UN, One Voice, a space where we unpack the most pressing issues facing Timor-Leste and explore collective solutions with those driving change on the ground. Today, our focus is on healthcare and well-being, a matter that affects every Timorese family, every community, and the future of the nation. From maternal and child health to communicable diseases, Timor-Leste's health sector faces layered challenges. Yet, with national leadership, global support, and community engagement, the path forward is filled with opportunities. With us today are distinguished guests who bring policy, expertise, and program action to the table. With us today are distinguished guests who bring policy, expertise, and program action to the table. We have Dr. Arvind Mathur, WHO representative. Welcome to the program, Arvind Bhai.
Thank you.
We have Dr. Dominguez Bernardo. She is UNFPA's assistant country representative. Welcome to the program, Mana Dominguez. Thank you so much for joining us today. I welcome you to the program, which is around challenges, barriers, and strategic response within the health sector. So I will start with Arvind Bhai. So what are the biggest systemic challenges you see, Arvind Bhai, in the health sector in Timor-Leste, and how the government is addressing that and how we as partners are supporting that?
Thank you so very much, Ahmed Bhai, for bringing us together. It's really a pleasure and honor to be on this TV talk show with my esteemed colleague, Dr. Dominguez. I think it's a very pertinent question in current times because Timor-Leste has, as a young democratic country, have done remarkably well.
Very true.
When we talk about disease eliminations, like being a polio-free country, a country which has eliminated measles, neonatal tetanus, rubella, but also importantly diseases like lymphatic filariasis and malaria, and in a short period of time, but at the same time faces some daunting challenges in health sector.
Right.
And from our perspective, I would say the major one to begin with, we call it as a triple burden. And the triple burden means that it's a country which continues to have the burden of infectious diseases, the communicable diseases. There are, of course, the new and emerging outbreaks and the threats, be it of dengue, be it of Zika, be it of yellow fever, not in Timor-Leste, but in chikungunya, but most recently rabies. And also Timor-Leste continues to face the challenge of tuberculosis, as a high burden country. So that is first challenge for country to address. The second challenge, when I say triple burden, the second burden is the rising burden of non-communicable diseases. The leading cause of death today in Timor-Leste is actually heart problems. There are increasing numbers of stroke, of diabetes, of untreated hypertension.
Right.
And they today cause, almost 50% of adult deaths in Timor-Leste. If these two burdens of communicable and non-communicable diseases are not enough, we know that there is a huge challenge of undernutrition in the country.
And that is the third burden.
That is the third burden that I would like to reflect on. And we know that Timor-Leste is one of the countries with the highest burden of child malnutrition, with almost 47% of less than 5 years of children who are found to be stunted. And it actually holds the country from, whole development, because that stunting, that undernutrition creates problems all over, including bringing the infectious diseases. But increasingly, the threat in this third burden is also of lifestyle, because there is an increasing number of trend of children with obesity also. So the other spectrum of malnutrition.
Very true.
But I would also like to add that in addition to this, our early gains in the field of maternal, newborn and child health, they have slipped down. And that becomes a major challenge because the stagnating maternal, newborn, child mortality and being a young country, if we do not address that, that pose as a major threat and a challenge. And all of this is actually critically important for health system to be cognizant of, to be responsive of. And that's where the need for health system strengthening, the need for health system to be resilient, to be able to be equipped with the right workforce, that is what we call the human resources, the right equipment, the right diagnostics, the drugs, and to be able for the people to receive the services in a most respectful manner closest to them. So all of these, with the geographical challenges, with the challenges of the transportation and all, are the challenges or the threats that the health system and health sector
is facing,
despite the fact that we are very privileged that every citizen of Timor-Leste is entitled for a free care at the point of care. And this financial hardship is not there, which is actually a challenge in many other countries. And this is where we are looking into, how does the families receive the quality care which is closest to them, and how system actually is able to respond to them. So I think in terms of the challenges and the threats, I would just like to summarize it in this way. And we'll take how do we go forward on responses.
And the next one. Thank you, Dr. Arvind Bhai. I mean, so nicely capturing the entire gamut of the situation and the entire issues. I mean, in your summary, it's and setting the scene actually very comprehensive and brief at the same time. But we will unfold as we move forward. We will unfold these things. Just picking up on your point about the systemic challenges. I mean, especially from WHO's point of view and perspective, what are the priorities in your understanding in terms of how to address these public health threats in Timor-Leste?
See, like the public health threats are so diverse, so wide. And as I said, that the ability to address them, the ability to respond to them actually comes from our ability for health system to be strong and resilient.
Very true.
And to that extent, let me take the example that we were looking at from the eliminations point of view. Because many a times we look into elimination as just a disease elimination. But a disease cannot be eliminated unless and until we have all the elements of health system responding to the need for eliminating the disease. So, I mean, like if I look into that, were the manpower there?
Yes.
Was the vaccine available? Was the quality and the safety of vaccine being so trustworthy that the people were able to accept? And if I look at it from this point of view, that why was I able, as a health system and as a health workforce, reach the last mile?
Very true.
And the remotest areas where the people live and provide that service to them. So, like looking into the public health challenges, there are so many of the, like actions that we may need to take up and use on one side our very conventional, time-tested, but as we call it, like evidence-based strategy and actions. And on the other side, bring innovations, bring newer technologies, bring the creativity, and to bring the solution, the evidence-based solution to the people for them to accept it as well and then get the benefit. And that's why, like when we look into the health system increasingly now, we are also talking about the health system to be climate resilient and environmentally sustainable, so that we are not adding to the what we call as the carbon footprints, but the carbon footprints should be reduced by the health sector as well.
Very true. And
so that's like a broader area.
Yes. I mean, that will be health sector's contribution to the climate action.
Absolutely.
Yes.
Yeah.
And I think WHO has done a lot of work on that also, but we will get back to that side later.
Yeah.
I had next question on that, we have we have had back-to-back eliminations, I mean, in Timor-Leste, but I will get back to you
Sure.
On that question in a while. Let me have a chat with Mana Dominguez and request her reflections from UNFPA's point of view. So, Mana Dominguez, I mean, despite progress, I mean, maternal mortality, which is, UNFPA has been working on this for years and years. Despite the progress, despite the actions, despite the inputs and achievements, maternal mortality remains high in Timor-Leste. What are the contributing factors, you think, and what targeted interventions are being implemented, in the country, and how UNFPA is supporting that in collaboration with other agencies also?
Okay, thank you very much, Ahmed. I'm very happy to be here with, of course, my guru, Dr. Arvin, an expert on sexual and reproductive health also. For me, from UNFPA, of course, one of the agencies really focus on sexual and reproductive health and rights. And you correctly pointed out that there is a lot of achievement or progress made in terms of maternal health. But I would like to say the remain challenges is there, need to be addressed. And I would like to respond to this question to start with saying that maternal death cause is more than the direct cause. It's very much influenced by the social economic determinants. And I would like to use the 3 delays.
Right.
It's still relevant with Timor-Leste context to respond to this question, to the factors that contribute for maternal deaths in Timor-Leste. Of course, number 1 is delay in deciding to seek care. Why this is happening? Number 1, for example, is gender inequality is very high, still a big challenge in Timor-Leste.
And these are the additional challenges, actually,
These are additional challenges.
Additional challenges, actually, in relation to the actual challenge.
Yes, the actual challenge, of course,
gender equality.
But gender inequality remains a challenge in Timor-Leste, and in this made the women, they cannot decide for themselves.
Very true.
But the family, the husband, the in-laws is the one deciding. So this is the things that also delay for them to decide to go to health facility to seek care. And number 2, of course, lack of limited knowledge, awareness of the danger signs during pregnancy, during delivery, and others. So this is also delay in making decision to go to seek care. And number 3, of course, on the cultural barriers. They are preferring to deliver at home and assisted by traditional birth attendant instead of going to facility and assisted by skilled birth attendant. And number 4 also because of the transport
logistics,
poverty.
Logistics, poverty.
Yeah.
Exactly.
The second delay, of course, when they decide to go, there's a barrier.
Right.
They cannot get the transportation because of no money to pay the transportation. The geographical, the distance, majority of women living in rural area, which they need more than 3-4 hours or even 5 hours to work to reach a facility. The third one, of course, of lack of transportation.
Right.
To reach the facility. The most danger one is the third one, when they already reach the facility, but they don't receive adequate care that they need, the women need. So one of the issue, for example, there are no trained providers. The clinic is closed after you travel 3 to 4 hours, and then you don't get appropriate care, or lack of medicines, for example. And one of the big things I would like to say here is when they reach the facility and they get no empathy, they don't get the right care, or somebody, and then the baby die or mothers die, and this will not make the mothers to come back to the facility. So this is the three important
3 delays and the contributing factors.
Yes.
Mainly. Yeah.
Yes.
But the second bit of the question was that how we are responding. What is your recommendation as UNFPA's leadership? That how to do that, and how we are responding, how UNFPA is contributing, how UNFPA is supporting the government together with other UN, sister UN agencies?
Okay, so UNFPA, of course, we work together very closely with WHO,
Very
UNICEF,
true.
and other
And that's why we are
partners.
together on this program.
Supporting, yes. This is one of the very good coordination actually between the sister agencies in responding to
Very
reduction to how the key component for program to reduce maternal mortality and newborn death. Of course, since 2015, WHO, UNFPA, we invest a lot on strengthening and improving the accessibility, availability of for maternal health care services. And one of the good example is we work together to establish the BMOC centers. We start with the establishing clinical training center, which is based in Hospital Nacional, because for emergency obstetric care, the providers need to be really trained. These are clinical competencies that are going to save mothers during delivery when they face the complication. It's like 10 to 15% from WHO mentioned that around, for example, in Timor-Leste, around 6,000 mothers, they can also have this complication during the delivery. So there's one of the. So how we are doing? We beside the training, we also put emphasis on functional facility, the health facility. That's why UNFPA with partners, with support from partners, for example, from DFAT, from Japan, and then from Thailand, and together with WHO and UNICEF, we upgraded facilities to ensure their function in order to deliver the services, the quality of services. The second, of course, the center has to have available of medical equipment and non-medical equipment, life-saving maternal drugs, in order to deliver the services. The third one, of course, the providers need to be trained. There is 26 clinical competency-based training that UNFPA, together with WHO and UNICEF, focusing on emergency obstetric care and newborn care, to train providers in all community health centers that has maternity.
Thank you, Dr. Dominguez. Thank you so much. I mean, in a very short time, I mean, you have, put together, given us a good flavor and given us a good summary that, how we are supporting. But there are lots of other questions as we move forward. Like, you mentioned about trainings, you mentioned about, upgrading the facilities, you mentioned about, making sure that drugs are there. You also mentioned that, the relevant and right equipment is there. So this brings us to the close of the program. Thank you so much, Arvind Bhai. Thank you so much, Manu Dominguez, for joining us today. Today's dialogue reminds us that health is not just a sector. It is the foundation of human dignity, national development, and better future. From policy to practice, the commitment to improve healthcare in Timor-Leste is real. But it will take all of us working together to turn the vision into a reality. To our guests, thank you for your leadership and insights. And to our viewers, thank you for tuning in. Until next time, stay informed, stay healthy, and continue raising your voice for better Timor-Leste. And goodbye, and thank you so much.
Thank you.
Thank you very much.
Obrigado, Bara.